Mumbai, we understand the team of 150 doctors have been designated to tackle COVID-19 cases in Dharavi. These 150 doctors will be dedicated to the slum cluster of Dharavi itself. This team will work with not only health experts from the BMC, but also their staff. The motive is to screen all people via fever clinics dedicated to Dharavi and isolate suspected patients and make sure they're in quarantine. Arunil, my colleague, will be joining me for more on this. Arunil, it's a dedicated team of doctors that will in fact via fever clinics make sure that everyone living in these areas is screened.
Well, that is right, Atar. In fact, Dharavi, Asia's largest slum with a population of 8 lakh people staying in pitiable living conditions, remains a Herculean challenge for the BMC and the state government. So now a new action plan has been initiated, wherein 150 doctors designated only to the Dharavi area will be operational over there. They will be working in tandem with the BMC Health staff in Dharavi. And also, the main motive will be to basically screen each and everybody in the Dharavi area and to isolate patients who are suspected to have the coronavirus symptoms. With respect to other things are concerned, one designated hospital, that is the Sai Hospital, has been given to Dharavi itself. And in the morning, there was Varsha Gaikwad, the MLA from Dharavi, who mentioned about it, saying that in that hospital there is only one ventilator at present available. So that is an extremely serious concern. So she has written to the CM of Maharashtra saying that they want more hospitals for the Dharavi region. Till now, there are 3 deaths from this Asia's largest slum, and there are cases more than 15 from the Dharavi area only. The biggest problem for these doctors will be to alienate symptoms of the people over here, because most of them have some kind of an underlying ailments, be it tuberculosis or some other disease. So alienating symptoms of coronavirus with the other diseases becomes a big challenge over there. And also social isolation remains a huge issue in places like Dharavi. Sanitization work has been carried out on war footing in Dharavi as well. Back to you.
All right, Arunil. We'll also take a look at what our colleague Kajal Iyer had to say in this report. She filed this report from Dharavi itself. Take a look.
With number of corona cases increasing in Mumbai, the containment zones are also increasing in number. At last count, there were more than 300 containment zones within the city, which included buildings and also certain localities where more than one positive case had been found. Slums like Dharavi, Varli, Kolivada still continue to remain as containment zones, whereas certain buildings like in the posh areas of Vadala, which were initially declared as containment zones, are now seeing some form of relaxation because there were no new cases found there. So it's not just posh residential locations, but also slum areas that find themselves in the list of containment zones here in Mumbai. And the government is still trying to grapple with testing and tracing of contacts in these containment zones. As aggressive testing, random sampling continues in these containment zones, the numbers in Maharashtra are expected to increase. In fact, when it comes to just the BMC Commissioner, Praveen Pardeshi, he seems to think that the peak that Mumbai is expected to hit will come only in 3-4 days now, and that we are still not hit the peak, which means that we could see a further rise in number of cases in the coming days.